There we go. Okay, we've got someone in the stream. Hello. I don't know if you were here for yesterday's stream. I am Rachel. I'm currently in a mental health clinic in New South Wales, Australia. Yesterday was my first live stream. Well, actually my second. I just decided to give it a go, and it seemed to be a bit of a hit yesterday. So just send me your questions. I think I'm just going to make it a bit of a quick one tomorrow because I've actually got a plan for tomorrow's one. And also a few people have asked if I set up a YouTube channel, so I'm actually going to do that. If you want to know, what it is, just send me a message or something, but I think I'll quickly put it in tomorrow's if you find me interesting, which I still find insane. So let's just have a look at these chats. Are you a patient? Yes, I'm a patient. I know that surprised a lot of people because when you see the background, you think, oh, is this a mental health clinic? But this is actually in the private system. The public ones can be quite horrendous. I do have a bit of experience in them, thankfully not much at all, but they are sort of what you expect a mental health clinic to be, like very white, very sterile, nurses watching every 15 minutes, that sort of thing. And to be honest, they were quite scary, but this one's in the private system. It's a minimum security. So we can leave as long as we're what's called category 1. Except with the COVID thing, we actually can't. We actually don't have free leave anymore. But it looks like the restrictions are easing here in Australia, so hopefully that's not the case for too long. We are allowed devices, we're allowed our phones, things like that. So why are you there? Primarily depression, anxiety, and OCD. I also struggle from anorexia nervosa, but right now I'm kind of managing it a bit more. I've been experiencing anorexia nervosa since I was 14, and it's kind of gone like that, and for me it's just sort of a matter of managing it. I have been in hospital specifically for that, but right now it is being managed, and I am primarily here for depression, which I've experienced since I was about 9, OCD since I was since the same time, and I've been anxious my entire life. Okay. Alright, we've got a few people in here, so just send me your questions, if you have any. I'm not a particularly interesting person, I promise you that. I'm happy I'm not interrupted, actually. I put a sign on my door, but who knows. This chat's probably going to be a bit of a shorter one, certainly shorter than yesterday. I've got some plans on what to do for tomorrow's chat, if anyone's interested in joining me for that. A few people asked that I set up a YouTube channel, so I'm considering doing that, but I'm still really new to all of this, and yeah, honestly, I can't see that I'm that interesting. How do you open up to people? I find it really, really difficult. To be honest, look, I don't on the outside really. Certainly not about mental health because there is still so much stigma surrounding it, unfortunately. That's actually one of the things that I'm actually trying to do with these videos. I'm actually trying to open up a little bit more, and I hope that if I do start a YouTube channel, that's what it's going to be. You look like you have been making progress. Thank you. I really appreciate that. So sorry, just back to the first one quickly. How do you open up to people? I find it much easier in here because firstly, everyone's so lovely, but secondly, everyone also suffers from mental health issues, so we all kind of know. So we all kind of know what we're going through. So it's kind of like a matter of you start a conversation with this person for the first time and immediately you're talking about these deepest things. We understand each other so well. So you look like you've been making progress. Thank you. One of the things that a lot of people think with anorexia nervosa is that we hate hearing that we've gained weight, or we hate hearing that the bags under our eyes aren't as bad, or we hate hearing that we're looking healthier. But this isn't about vanity. People don't start this because they want to look like models, and I really appreciate that you think that I'm looking better because I know I look like crap. So thank you. Spiritually, I got labelled with mental health issues. I'm not quite sure what you mean. I am really sorry, because it sounds like you know, it was really unpleasant for you. So yeah, I am sorry. What in the Alabama sister fucking tarnation? Nice, that's a good one. What are your dreams like? I'm not sure if you mean my dreams as in sleeping dreams, or my dreams as in aspirations. I guess my aspiration, I'd love to be more of a I'd love to continue my work as a scientist, possibly go on to further postgrad, pick up my saxophone again, but my major aspiration is just to be happy in life. Sleep dreams. Okay, fair enough. Sorry, I probably bored you. Do they restrict phone/internet access? We have Wi-Fi here, and phone access, none of that. Just because we are a minimum security unit. Sleep dream. Hello, my lady scientist. I love that, my lady scientist. Oh, hello to you too. Thank you for that. Sleep dreams, you know, same as everyone else's, weird and wonderful, and these days I'm not having a whole lot of them. How do we help people with anorexia or talk to them? No, thank you, that's a wonderful question. Look, the biggest thing is just listen to them. There's this whole idea out there that this is about we want to be a model, or we are just, or this started for vanity, and it's not true. I mean, or that it's a choice, but think about it. Eating is the most basic primal instinct of human beings to keep us alive. So to be able to fight that, clearly there must be something more going on. Clearly there must be something literally different about the brain. There was a genetic study that came out a few years ago that showed that this is a metabolic illness, that there's a huge genetic component, and that there are actual differences in the brains, like actual structural differences of people with anorexia. So please, the first thing is don't make assumptions. You know, don't think, oh, this person just wants to be skinny. The second one is, if someone says that the treatment they've received has been barbaric, please listen to them. I know it can be really easy to dismiss, because you think, oh, well, they were forced to eat, so of course they hated it. But most people who I've spoken to, their treatment has been quite barbaric. I'm currently being treated for trauma because I was forced into treatment, and I completely understand that I was forced into treatment, but what happened to me there was not just, and what I saw happen to other people was horrendous and would give anyone nightmares. So please, if someone says that the treatment they've received is barbaric, is not right, please listen to them. In fact, the place where I was sent 3 years ago has since shut down because they realized, yeah, this was going on and this isn't okay. So I hope that in the future it changes. But yes, please, the biggest thing is listen to them, provide support. Yes, eating is obviously required, and yes, it is obviously going to be difficult for these people, but please be gentle. Be gentle with them, be gentle with us. Luckily for me, I've reached a point where I am able to, eat again. It's just a matter of how much I'm eating and how much I'm exercising, which is driven by OCD, not anorexia. The other thing is that people with anorexia will usually suffer from comorbid mental illness, such as depression, such as anxiety, such as OCD, if not more than that. And those things also need to be addressed. So thank you very much for your question. A gentleman greets you, my lady. Greetings to you too, kind sir. Kind of fucking out there myself. How do you try to be social and normal? I completely understand. In here, it's actually great because you don't have to be normal. Like I can go up to people and say, "Hey, how are you today?" And we know that instead of just saying "I'm fine," we'll actually open up to each other. It's fantastic. Out in the real world, it's much harder, and I hope that's going to change because we're realizing how many people out there have mental illness, and I'm hoping that in the future more people open up because you'd be amazed. Is there a precipitating factor why you're depressed? huge genetic huge genetic component. I'm realizing now that there were a few factors in my childhood which may have contributed, but for me it's majorly genetic. What is the goal for your treatment? I just want to be happy. That's it. I just want to be happy. You ever play a baritone? Once. It was at the time, it was literally as big as me. I think I was about 12 or so, and I was a tiny kid. So it was pretty funny. You've just tried a particular medication for anxiety. What tips do you have about losing yourself? You're an artist and anxiety has been a huge factor in your life. Completely understand. For a lot of people, they're worried, how much of this is my personality, how much of this is actually driving me. If I lose this, will I lose that drive? Will I lose that motivation? Completely understand. I've had the same thoughts, but I think at the end of the day, you have to try it. You have to see what works for you. And you know what? You may find that you do lose your motivation, and it's at that point, it's a matter of choice. Are the benefits of this, do they outweigh the bad side effects? But the first thing is you do have to give it time. That's the big thing. You do have to give it a lot of time. Like, a lot of people think that it's going to be an instant fix, but every medication is different. Everyone will respond differently, and it does take a while to accumulate in your body for some of them. So I do wish you all luck. The comments here are a whole lot more wholesome. I completely agree. You're all such lovely people. I was so scared when I started, but you've all been so wonderful. You've had bad depression, anxiety, and PTSD. I'm so sorry. And for anyone out there struggling, look, firstly, I am not a clinician. I am not qualified to give you advice. My biggest tip for any of you, because we're all different, we're all going to respond to different treatment. Just seek help. That's it. If you're too afraid to go directly to a psychiatrist or psychologist, go to your GP. They can refer you to someone. If you're not even ready for that, then go to your family or go to your friends and open up to them, and then let them decide. It may be a case where you're too depressed or too unwell to make those decisions for yourself and to go and actively seek that treatment. So honestly, trust them and let them seek it. Let them make the phone calls, and just trust that things can get better. And I know that right now that doesn't mean anything to you, and you're probably bloody sick of hearing it. But it is true that things can get better, but the first step is getting help. Okay, so I really hope you get through this. This is dope. Just stumbled upon it. Nice. Do you know how I can get out of messed up treatment? The first thing is, if you know that it's messed up, that's the first thing. I know when I was getting treated really badly, I wasn't sure, is this normal? And it was only later that I found out that it wasn't. Only on one occasion I've actually been scheduled. I was of complete sound mind, but I didn't know the laws surrounding it. So look, the first thing is that if you are in a matter where you are being forced by law into this treatment, then that's a whole different matter, and I'm not qualified to answer. I do apologize. I know that there are some ways out of it, but it's different depending on your country and on your state. If it's a matter of being in messed up treatment because you're underage and it's sort of your parents forcing you into it, if you know that it's really, really bad, it might be a matter of seeking outside help. If you're an adult and you're in this messed up treatment, again, it's completely different for everyone, but I will say it, I will again say that I'm not a clinician. Don't make changes based on what I say. Sup, Karen. Nice. I do understand that. You're clearly a lovely person. Uh, yeah, I do know what you mean, but don't make changes based on what I say, because my level of understanding, it's not where it's not the level of a clinician. So please, yeah, it might be a matter of seeking out another clinician. It might just be a matter of changing clinicians, because not all of them work for all of us. What's wrong with you? Okay, so firstly, I am of completely sound mind. It's not a matter of psychosis or anything like that. Not there's anything wrong with that. I'm here mainly for depression, OCD, anxiety. They've been long-standing, and yeah, they've been very long-standing and very frightening, and I'm getting very, very I'm just getting tired. You look like you need a hug. I do. Thank you very much. Schema therapy. I haven't actually. No, I don't. I've heard of it and I've read about it, but I don't have actual experience on it. Sorry. How do you confront? Nice. How do I confront my grandma who stole my horse and used it to rob a train and is now in a hideout? Nice. I hope you're joking. Yeah. I don't know. Maybe say, Grandma, what the hell? Although she's in a hideout, that might be different. Nah, not sure, mate. Good luck. Sending love from a fellow therapist. Thank you. Yeah, all my best too. What part of Australia are you in? I'm on the. I'm in the eastern side. Weird nod to that Karen comment. Yeah. Do you have OCD or pure? I'm not sure what you mean by that. I do have yes, formal OCD. I won't. It's not a matter of, I clean my room, I'm so OCD about this. And by the way, saying I'm so OCD about this makes no sense. I'm not going to go and say I'm so, diabetes about this. So please stop saying that. Yes, I do have severe OCD. It has destroyed a large portion of my life. When I was a kid, it would take literally about 6 hours out of my day just performing these rituals. So yes, I do have OCD. LSD. Mate, I'd love to try it. I'm sorry, guys. I'm sorry that I can't get to all of these. Absolutely spot on. Oh, thank you. Yeah, I hope so. You have a career for you in mental health. I hope so. I would, if there's anything that's good that's come out of the last 20 years of plodding through this, then I hope that, I hope I can find it. So you are ill, are you getting better? It fluctuates. It's fluctuating. You have OCD and wash your hands many times a day. Oh, me too. I do have a tip for that, and it's moisturizing, because your hands will crack. I am sorry. I'm really sorry for you, because it sucks. I think my sister is bipolar. Okay, so you think your sister has bipolar. Maybe if you're serious about it, rather than, I know that a lot of people say that, you have mood swings, you must have bipolar disorder. If you are serious about it and it is causing a lot of distress for her, please seek help for her. Antipsychotic are black magic. They are the work of the demon. Look, if you're saying that because you've had really bad experiences, then I do apologize to you greatly, and my heart does go out to you. If you're just saying that because you've learnt what you've heard in the media, they save lives. They don't work for everyone, but they can save lives. Microdose mushrooms, again, I would love it. You look sick. Look, I know I look like crap. I'm doing my best. Bipolar, you poor bugger. I'm so sorry. I don't experience bipolar, but I know a lot of people who do, and it's horrendous. Yes, please stop saying OCD. I'm so OCD. Yes. yeah, cannot say enough about that one. OCD is no joke. No, it's not. She's pretty. Oh, thank you. Yeah, thank you. It's nice to hear. You need sleep. God, I do, mate. I do. Is everything all right with you? Well, I'm in a mental health clinic. It's not great, but I'm trying. Not looking sick. Thank you. I appreciate it. Have you been feeling depressed lately? Yeah, very. Oh, you guys are so lovely. I want to move in with a friend, but I'm really anxious about it. Scared if I leave my parents' house and stuff gets bad, I'll have nowhere to go. Oh God, I'm so sorry. Yeah, I'm so sorry. It's not my area of expertise, but as with the case with everything, please seek help from outside sources. What led to your OCD diagnosis? Okay, I'm going to pause for a bit of a tangent here. Hopefully this expresses just how horrendous OCD can be. So I was 10 years old. I know the date. It was July 23rd, 2003. I was 10 years old and the 5th Harry Potter book had just come out, and I was really anxious about reading it. So I was lying down on my bed and I read through the first page, and then something inside of me, it wasn't a voice, it was just this impulse, like an itch, said, you have to read this page again. I don't know what it was completely bizarre. But I read through the page again and the impulse went away. So I got to the end of the second page and the impulse hit again. And by this point I'm starting to get distressed and I'm starting to get scared. Got to the end of the third page, the exact same thing. And by this point I was so frightened. I thought I was going to be institutionalized. Thankfully my mum is the most amazing person in the world, and she knew what it was. She knew what it was immediately, and she reassured me, and she got me to a doctor, to a child psychiatrist, and it was very clear very quickly. That first year of having the OCD was the worst year of OCD I've ever experienced. It was taking 6 to 9 hours out of my day. It took me 3 hours to get to bed because I had all these rituals that I had to perform, even though I desperately didn't want to. It was such a sad time, and such a frightening time. As my stress got relieved, when I got into high school, there were a few good years there. As my stress dropped, naturally the OCD dropped. As my stress increases, naturally the OCD increases. Right now, I do still have some rituals that I do have to carry out, but it's certainly nothing like it was back then, and I'm managing it. The way I describe OCD is that it's like eczema. If you have skin that doesn't have eczema, you might feel an itch, you scratch it, the itch goes away. There's nothing in your head telling you to itch it, it's just this impulse, you need to scratch it. If you have eczema, it's like having OCD. You scratch that itch, the impulse is gone for a moment, then that itch comes back, only it's worse. So you scratch it again, the impulse goes away for a moment, comes back 1,000,000 times worse. How do you stop it? The only way is to fight it, but that is so much easier said than done. It's like fighting that itch. It's horrendous. It's like trying to stop a sneeze. So yeah, for anyone who thinks that OCD is a small thing, or it's just a matter of, I clean my room every day, therefore I'm so OCD. It's not that. It's horrendous, and it can be life destroying. So to anyone who does have it, my heart goes out to you because I know what it's like, and it's absolutely awful. But it can get better. Mine got a lot better naturally as the stress lessened, and I sort of learnt to fight it myself without a whole lot of outside help. So yeah, again, my heart goes out to you, and it can get better. Okay. That's hard. Hopefully this year is better. Oh, thank you. At the end of the day, I just remember that we all have our struggles. Mine are no greater than anyone else's. Yeah, I hope to anyone out there who's struggling, I hope that you go well as well. You're amazing. Thank you. I'm really not, but thank you. I do apologize. Sorry, my mind just wandered there. But thank you. I do appreciate it. To eat baby meat. Nice. Okay, that's a little weird. Good luck. Sorry, these are going. Difference between OCD and anxiety. OCD is marked by what's called obsessions, which are the thoughts you have in your head surrounding a particular ritual or something like that, and by compulsions, which are the actual act of whatever. I have the impulse right now to tap my hand twice, then the obsession is thinking about tapping the hand twice, and the compulsion is actually doing it. So that's sort of what OCD is marked by, and you can read that up in the DSM, the Diagnostic and Statistical Manual. Anxiety, I don't know, it's a bit difficult to describe off the top of my head. Yeah, there are far more qualified people, and again, have a look in the DSM, but they are distinct from one another. You're chill. I like you. Thank you. I'm trying. Is this an ED talk? No, I can touch on it, but no, it's not particularly. Anxiety is broader. Exactly. You were in that 7 years ago. I'm so glad you're doing better. I'm so glad you're doing well. It's wonderful to hear the success stories. Regarding, what's your name? I'm Rachel. Okay, I apologize. I mentioned at the top of this stream that it was going to be a bit of a shorter one than yesterday. I do have plans to make a longer one tomorrow, but I do have to head off right now, so I do apologize greatly. If you're at all interested, I'm not a particularly interesting person, but I'm going to be making another stream, or at least trying to make another stream tomorrow. So, if you like it, you can follow me on Reddit, because then you'll know when I do the stream. Again, I'm not a particularly interesting person. What's the topic? I'm planning on talking more in depth about life in the clinic tomorrow and what goes on, because there's a whole lot of misconceptions surrounding life in a mental health clinic. Not that I'm here for life or anything, but yeah, that's the plans for tomorrow. So yeah, if you're interested, come then. Someone suggested that I start a YouTube channel. I don't think that I'm quite interesting enough, but I might do that. So I might have a channel for you tomorrow. But yeah, as always, I'm just going to close this by saying, if you do suffer from mental health issues, if you do think that you suffer from mental health issues, please seek help. There is help available, and you are worthy of it. You are worthy of happiness, and any mental health issues, it doesn't make you insane. It's not something that makes you a bad person, but they can really impact lives, and they are a lot more serious than the media seems to make out. So please do seek help for them, because you are worthy. And I would love to hear some of you saying that you're getting support and that you're getting help you need. Alright, I hope you're all doing well. I hope that some of you might pop in tomorrow. For the meantime, just keep safe, take care of yourself, and be kind to yourself. Okay, thank you everyone. See you later.